In this video, we'll be covering Mycobacterium tuberculosis. We have a lot to cover in this story. A lot. Like, if you're planning on watching it all in one sitting, I'd consider DVT prophylaxis. But we did try to pick a theme that would keep it interesting. It's a story that takes place in the Wild West, and it's called Shootout at the TB Corral. Let's start off by drawing the scene's background and talking about some general characteristics of Mycobacterium tuberculosis. First of all, you should know that TB stains acid-fast. This means that it takes up carbofuchsin stain. Our symbol for acid-fast, if you remember from the Nocardia video, is the acid-fast quick-draw gunslinger. Recall, however, that Nocardia is only partially acid-fast, but TB is the real deal. So let's draw our acid-fast gunslinger over here behind this cart. The reason that TB is acid-fast positive is because of the high concentration of mycolic acids in its cell wall. These waxy, fatty acids take up the dye and trap it, and prevent it from being washed out during the rinsing phase. To help you remember this, we're going to use the same symbol we used in our Nocardia story, the two branched tassels. We're going to have them coming off of our acid-fast cowboy's shawl and chaps. Remember, we chose to use the two branched tassels because they look like the two waxy side chains that mycolic acids are composed of. Finally, just to really make this stick, we're going to give our cowboy's gun and holster a fuchsia color. This should help you remember the carbofuchsin stain. TB cultures very slowly, requiring anywhere from 2 to up to 6 weeks for growth. They also require a special growth medium, which is called the Lowenstein-Jensen medium, and it's composed of starch, egg, and other ingredients we don't need to know that inhibit the growth of other bacteria that may be present in a patient's sputum. To help you remember the special auger, we're going to name our building here the Lowenstein General Store, for Lowenstein-Jensen. I think it really does sound like an old Western store. Another important characteristic of TB is that it's an obligate aerobe, which is another way it's like Nocardia. To help you remember this, we'll use the same symbol we used for obligate aerobe in the Nocardia video, which is air bellows. We'll have a sign up here on the general store advertising that they have some air bellows in stock. Again, this is for obligate aerobe. We're going to stop talking about virulence factors for just a second to talk about transmission, which is key for our understanding of other virulence factors. TB is transmitted from human to human through respiratory droplets. Once it's infected someone and fails to be immediately cleared by the immune system, the microbe primarily resides and proliferates in macrophages. To remember this, we're going to draw a cart here with the macrophage cage that we originally used in Salmonella. We'll get back to the progression of the disease in a bit. We've still got a few more virulence factors to cover. Aside from mycolic acids, the Mycobacterium cell wall also contains some glycolipids that are involved in the clumping of the bacteria into a serpentine-like formation. These structures are essential for virulence. If a strain doesn't form these serpentine shapes, then it's not virulent. Another name for these structures is cord factor. So what exactly does cord factor do? Well, it has several functions, but its role is to protect the bacteria from being destroyed. It does this through eliciting granuloma formation by increasing TNF-alpha and other inflammatory cytokines. This will, in turn, activate other macrophages. Wait, what? How does this protect the bacteria if it's activating the immune system? Well, sure, the bacteria can't spread anymore, but it also allows the bacteria to remain walled off inside a granuloma, which is created by these newly activated macrophages. To remember the cord factor, we're going to give our cowboy a lasso. This shape should help you recall the serpentine shape of the cord factor. We'll have him wrapping up the driver of this macrophage cart to remind you of its interactions with macrophages. The last virulence factor we're going to discuss are sulfatides. These are actually what allow TB to survive inside cells like macrophages. These sulfatides prevent phagolysosome fusion, thus sparing the microbe from exposure to lysosomal hydrolases. The sulfatides accumulate in the phagosomes and create incompetent secondary lysosomes, which are then unable to fuse. To help you remember this, we're going to draw different sized dust clouds here behind our cowboy. We've placed them near these spurs on his boots. The spurs are supposed to represent sulfatides, and these dust clouds are the lysosome and phagosomes. that are kind of floating around on their own and not coalescing into one big cloud, or phagolysosome, which is what happens when TB accumulates sulfatides. And that should be strong enough to help you recall the mechanism of this virulence factor. Okay, now that we've covered the important virulence factors, let's go through the progression of TB. Once someone's infected by TB, they have what's known as a primary infection. After this primary infection, there are essentially 3 different outcomes. One is a healed, latent infection. Another is that it can cause a systemic infection that can be particularly severe. And finally, the third possibility is that an infection that once was latent reactivates later in life. Okay, let's talk about primary infection first, which affects the lungs, and is primarily either the lower or middle lobes of the lungs. After the primary infection heals, the lesion becomes fibrotic and eventually calcifies, as do the nearby draining lymph nodes. And together, this forms what's called the Ghon complex, which are visible calcifications of the lung parenchyma and hilar lymph nodes that can be seen on chest x-ray. We're going to help you remember all of this with a cactus. Let's draw it back here on the left. We tried to make it look lobular, like lung lobes. Notice 3 lobes on the right and 2 on the left? We have bullet holes here going through the middle lobe to remember where primary TB occurs. We've also added red cactus fruit here in the region of the hilum to help you remember hilar lymph node involvement. And to remember that these signs together are referred to as a Ghon complex, we'll make this building behind the cactus a gun store and call it the Ghon complex. TB specifically creates the caseating type of granulomas. You should have learned or will learn about this in your pathology course. But just to review, granulomas are basically formed in an attempt to wall off an area of infection. They are characterized by a collection of activated macrophages, or Langerhans giant cells, and in the case of tuberculosis, there's a central area of caseating necrosis. These granulomas often develop fibrosis and scarring. And another name for the granuloma surrounded by a scar with a central area of necrosis is a tubercle. To remember caseating granulomas, we have these carts on the left and the right of the drawing that are broken down. Remember, we said that these carts represent macrophages? Well, the broken carts that are falling apart represent necrotic macrophages. The cart on the right is filled with potatoes, which are a type of tubers, which demonstrates that Mycobacterium tuberculosis resides within these granulomas of broken down necrotic macrophages. Before moving on, let's first discuss primary infection symptoms. Contrary to popular belief, primary infection doesn't present with much more than a prolonged fever and is most commonly in children, in areas that are endemic to tuberculosis. It's also important to know that most cases of primary TB resolve, heal by fibrosis and calcification, and become latent. To remember primary TB's association with children, that usually resolves by fibrosis, we'll draw a kid down here on the left side, sleeping in a burlap sack. The sleeping kid should remind you that it often resolves and becomes latent, or it hibernates for a while. Also, the sack made of burlap, which is a really fibrous material, is to remind you of the fibrosis that occurs. Also, notice he's sleeping against a shovel, and the shovel's going into the ground the same way a needle goes into the skin when you're given a TB skin test. This is a link to remind you that if someone gets a primary infection, they then develop a positive tuberculin skin test, or a positive PPD. This manifests as a wheal on the skin where the TB particles are injected. The lump is due to the type 4 hypersensitivity reaction, and this wheal is represented by this lump of dirt that the shovel's created. You should also take note that the tuberculin skin test can be positive in an active infection, a latent infection, or if the patient has ever received a vaccine known as the BCG vaccine. The BCG vaccine is developed from attenuated Mycobacterium bovis. Its effectiveness is variable, ranging from only 0 to 80% effective, so we don't routinely give it in the US. All you need to remember, though, is that it can cause a positive tuberculin skin test, even if the patient has never been exposed to TB. Remember I said there were 3 ways TB can progress after a primary infection? And we just learned about one of those paths, the latent infection. I mentioned that most cases of primary infection will heal and become latent. However, there are a few cases that can progress systemically, causing bacteremia. When this occurs, TB can seed almost any organ in the body, commonly affecting the bone, liver, and lymphatics. And this is a very acute, very dangerous process that can quickly progress to death. And this process is called miliary TB. The presentation is variable depending on the organ affected. So if you see a kind of fulminant multi-organ failure in a patient, especially an immigrant from an endemic area, keep miliary TB on your differential. To remember miliary TB, we're going to put millet seeds pouring out of this cart here on the left. Millet's a small grain, and when it's spilled, it can get almost anywhere, which should help clue you into the fact that miliary means it can seed multiple organs. Millet was a grain that was consumed in the days of the Wild West, so it fits well here. We'll also put a sign in the grain that says millet, so you don't forget it. And to associate miliary TB with being a potentially lethal infection, we're going to put a cow skull here on top of the seeds. A grim reminder of this serious infection. So now we've covered 2 of the 3 paths a primary infection can take. Now we'll talk about the last possibility, reactivation of a latent infection. Fortunately, most people with latent TB don't reactivate. Reactivation is only seen in about 5 to 10% of people, and its association is with a state of immunosuppression, such as with HIV, old age, and cancer. The mechanism by which immunosuppression causes reactivation is through the downregulation of TNF-alpha release. Recall that TNF-alpha is a pro-inflammatory cytokine that causes the infection to be contained. If that were then to be neutralized, the infection would spread again. To remember this specific mechanism of host defense downregulation, let's draw a guy here in the middle of the gunfight strapped to barrels that say TNF, as if it were a keg of TNT. This bound, defenseless guy tied up to a TNF keg is to remind you that your immune system is defenseless if its TNF is inhibited. A particularly clever way to test your understanding of this concept may show up on a microtest or a farm test. And this is that if you want to start a patient on a TNF-alpha inhibitor, such as infliximab, you should first screen them with a PPD to make sure that you're not putting them at risk for reactivation of TB. When TB reactivates, it primarily affects the upper lobes, as opposed to the middle and lower lobes during a primary infection. To help you remember this, we're going to have a second cactus on the right side. The cactus will show the anatomical location of reactivation. So just remember, reactivation is on the right side of the drawing. The cactus, of course, also looks like lungs, but this time we'll have the bullet holes in the upper lobes. There are 3 classic symptoms you should be aware of for reactivation of TB. They're cough, night sweats, and hemoptysis. The cough should be easy to remember because we know TB is a pulmonary infection. And to remember hemoptysis, or the bloody cough that may occur, we'll have a character who will be coughing out blood onto his handkerchief. And he'll also be sweating. And we've purposely made the scene take place at nighttime to portray night sweats. And finally, he's inside the macrophage cart just to hammer the point in that reactivation originates from within macrophages. Also, many patients experience cachexia, which is wasting and weight loss, and this is because of the TNF-alpha produced in response to cord factor. TNF-alpha promotes wasting. Aside from these classic symptoms, reactivation TB can affect other places in the body. Let's talk about 2 common areas, the skeletal system and the CNS. First, let's cover the skeletal system. Pott's disease is when TB has infected the spinal column. Usually, multiple vertebrae are affected, and there is demineralization of the bone with soft tissue swelling, which causes pain. It can progress to abscess formation, spinal deformities, and weakness due to loss of support. We're going to draw a stack of Potts here, and these Potts, for Pott's disease, really resemble vertebral bodies stacked on top of each other, and we've made them cracked and damaged on multiple levels. For some reason, I've been pimped on this point quite a few times. What is the disease called when TB affects the bones? And this drawing's never let me down. It was even a pimping question on the TV show Scrubs. True story. Now, CNS involvement is seen in about 10 to 15% of patients with reactivation, and this can manifest as meningitis or as a tuberculoma, which is a cavitary lesion in the brain. To help you remember this, we're going to draw another character here, fighting with our cowboy, just below the reactivation cactus. He'll be hiding behind this cart, with his hat getting shot off, and the bullet hole in the hat is to help you remember CNS involvement with possible formation of a cavitary lesion, or tuberculoma. Remember, we also use this hat with a bullet hole going through it in our Nocardia video. Alright, we finally move on to the treatment of TB. Hang in there, almost done. TB is often resistant to multiple drugs and has the potential to become even more resistant because the treatment period is very long. So in order to prevent further drug resistance, TB is treated with a combination of drugs. The combination you need to remember for your exam can be remembered with the mnemonic RIPE. R for rifampin, I for isoniazid, P for pyrazinamide, and E for ethambutol. To help you remember the mnemonic, we're going to put a sign here on the card of taters. The sign will say RIPE taters, and that should be strong enough for you to recall the treatment regimen. Finally, we'll finish up this story with prophylaxis of patients with latent TB. There are two main drugs used for prophylaxis, rifampin and isoniazid. And conveniently, these are the first two drugs in the RIPE mnemonic, so we'll highlight those two letters for you. We'll also give our bad guy on the right, with reactivation TB, our rifampin rifle. If he had used rifampin rifle correctly in the first place, his hat wouldn't have been shot off. And just so you know, prophylaxis with rifampin and isoniazid is for 9 months, a really long time, even longer than this video, which, by the way, is now done. Go take a break. You've earned it.